I'd like to welcome everyone here at our Burlingame facility for attending, and everyone out on the internet who is joining us for our GHIN Global Health Impact Network World Conference. I'm sitting here with Eric Zimmerman, and we'll let him introduce himself in a moment. I just wanted to just briefly talk a little bit about Global Health Impact Fund and Global Health Impact Network. You'll be hearing a lot about our growth and all the activities that are going on with our fund and our network over the next several days. But just briefly, we are a clinician-founded, funded, and driven venture fund focused on digital health, and as well as a global network of communities representing professions, specialties, and special interest areas with a focus on innovation, entrepreneurism, education, as well as finance and investment. And we welcome anyone out there who's interested in joining our network to join us. It's a very open network, and anyone who we would consider a healthcare professional is welcome to participate in our network. Okay, with that said, Eric, maybe if you could tell us a little bit about yourself. Eric is with Amazon Web Services, and they've been a very good partner for Global Health Impact Network and Fund. And tell us a little bit about yourself.
Thanks, Gary. I appreciate it. So great to meet everyone. I'm Eric. My background, as you were saying, founded, funded, and led by clinicians. It made me feel a little bit like a sellout. I did not end up getting my MD, PhD. I went straight to the venture world after doing bioengineering for a little bit. And so I spent about a decade as a VC out here in the Valley, and then most recently at Wuxi Healthcare Ventures, the corporate arm of Wuxi AppTech, and we became Six Dimensions Capital. We had about $1.5 billion under management, and I did early stage biotech platform investing in growth stage med tech and health tech, and then co-founded an ophthalmology therapeutics company that we took public. I then joined AWS, I don't know, about 2.5 years ago. I'm a principal in the healthcare and life science group, and I have a fun job of sort of being a technology and science and healthcare evangelist. And the idea is that, you know, it doesn't matter where technology comes from globally, just that it's helping people, and that startups are really the key driver of innovation. And so anything we can do to support them, that's a win in my book. So thanks for having me.
Great. Thanks for being here. I think this morning what we'd like, since we're kicking off the conference, we want to talk a little bit about the focus and vision for the network, and see how Amazon and Amazon Web Services looks at the way we're looking at what I refer to as the evolving digital health revolution. So the way we got here, you know, it's been a long path for me, and I pass on going through my long history, but it's been 35 years of healthcare, serial entrepreneurism in digital health, and being a physician informaticist for a large healthcare system that led me to found Global Health Impact Fund and Network. And the reason is that I was literally consulting around the country, training my colleagues with electronic healthcare records, and I think most of us know the response to that from most clinicians when they're first exposed to it. And there was a lot of very disenfranchised clinicians across the country, and then ultimately finding out across the globe. And part of it was because here we were, you know, coming through our own tech bubble and tech revolution, but yet the users of the technology were not being involved in the development to represent the workflow to make our lives easier. But at the end of the day, the other focus, which is really important to us, is there's a lot of white noise in healthcare. But I think that most of us, because the nice thing about healthcare is no matter who you are, whether you're the CEO or the chief of the medical staff, oh, nice. Hopefully that's not what happened 2 hands in. So that's okay. You got to make a joke about things like that. So basically, all of us, all the way down to the housekeeping staff, we're all patients. Okay, and at some time, where many of us are providers, and the only thing that's important is the health of the patient and the patient-provider interface, and anything that we can do to improve that collaboration. I reduce it down to it's a collaboration between two individuals. That's when we're doing, we're doing the right thing from a technology standpoint. And we have not been very good at doing that up until now. So for me, listening to all of these colleagues who were disenfranchised, the light bulb went off in my head after 3 companies and 35 years of healthcare, that really what we need to do moving forward was to do what Doximity probably should have done, was to create a place that promoted active participation by health professionals. It's funny, in my evolution, I started as a physician and a former dentist. I would say physicians, dentists. Then I started saying clinicians, and now I've evolved to health professionals, because there are many individuals that are involved in healthcare that are very much part of the system, yet they're not necessarily clinicians, or they're not taking care of patients directly. So to create that environment that actively promoted it, but it also became quite obvious that most clinicians that are taking care of patients love what they do. The obstacle is what has to happen to make that interaction. And of course, the pandemic has made that much more complicated for us in many ways, but it's actually created a huge opportunity for us in digital health. So we started with creating the network and the fund and being pragmatic. You can't start, I'm talking to someone from Amazon here, or even if there's a Google or a Facebook or whatever, you can't start a network and expect to make a lot of money with that network at the beginning. You need to be able to have the appropriate capital resources to build it. So that's why we started with a venture fund, because the venture fund gave an opportunity to our clinicians to actively participate in the due diligence, to avoid the Theranos investments of the world, okay? And also to participate in a way where now, if we were going to ask them to invest and participate in the upside, there's always the financial part of healthcare if we're going to push it forward properly, that they need to be involved in those decisions as well. But the most important was not at the front end, the first mile, it was after we made the investment. Most venture capital funds say, thank you very much, here's your $10 million, and we'll speak to you twice a year, and let's make sure that you are appropriately reaching the financial milestones that we expect. Well, that's not our approach. Obviously, when you have a venture fund, money is important, but that's why we have social impact in the name of our fund, is that we're very focused on what happens to that company after we put our money in and our resources. So that's where the network came for us. And the network basically was a network of health professionals who are now available to the companies that we are investing in. And we're talking not domestically, we're talking globally, so that we can promote digital technology in a way that brings high-level care to the most remote parts of the world. And who better to partner with than an Amazon, who is already doing that and been incredibly successful at delivering services and delivering merchandise to organizations and individuals in the most remote parts of the world. So it's a long, it's a usual Gary, very long introduction, but I think it sets the tone for what we're trying to accomplish with our fund, with our network, and with this conference, is to be able to collaborate in a way to drive our mission and our vision.
I love it. So why don't we just jump right in then? So something that really spoke to me is that you said, when you make an investment, that's when the fun starts, right? It's not, I'll see you quarterly for board meetings or anything. You really want to dig in, and that's part of why the network is so important. Can you give me some examples of some real value add? Because I feel like investors too commonly say, let me know how I can be helpful. And then again, unless they fund you, the help may or may not come. But I know with GHIF, it does come, right? So I'd love to kind of hear about how clinicians really have been able to kind of move the needle for some of these early stage companies.
Yeah, that's great. Thank you. It's a great question. And again, I think from an educational perspective, if you look at the life cycle of an innovation, right? I mean, it starts at idea generation, and that could be anyone. Any health professional can have a great idea. And we all, any of us that are, somewhat experienced entrepreneurs or working with an organization, it becomes very clear that there's a very big difference between having an idea and executing the idea, and then executing and making it successful. And part of that is the right team. And part of that is also the right resources available to you, which is not, healthcare is a very complex vertical. And it's difficult in many ways to penetrate healthcare in a way that provides a quality product, but also makes it successful at the same time. So for us, when we started creating the model which involved health professionals, it was done in a very intentional way to support every stage of that innovative process. So our network of communities creates collaborative environments around every aspect of the ecosystem of what it takes to go from idea generation all the way through commercialization. And, it's a very complex process that has multiple steps that have to be executed properly for success. So we've built the network almost like you build a company, in that we started identifying what's necessary to work with a health professional who has an idea that wants to then engage in that idea and make it successful, which includes the capital, right, from the fund side, but then it includes building a management team. And bringing in the appropriate resources to do that, bringing in the appropriate partners. I mean, AWS has been amazing for us because not only are we using AWS, but every one of the organizations or startups that we work with has access to AWS because of our relationship with AWS in a way where they get a discount on top of it, but then have the resources available to them, which is, obviously a very big advantage. We've done similar relationships with banking. So the bank for the fund, bank for the network partners with us and makes its services available to our startups. So they have that available. We've created shared services around finance and marketing and other services that are necessary, and not necessarily services where we're providing a service, but certainly educational opportunities to be mentored as to how to do things correctly, right? So you don't have to, as we say in healthcare, go through a lessons learned process of debriefing and correcting your mistakes. So we try to leverage that. And then the educational component was very important. Bob Sweeney is over there. He's waving his hand at me. Well, Bob and I have known each other for 27 years. And because my first company was one of the first online continuing education companies, we were leveraging it when the internet first started. And Bob at the time was running Challenger Corporation, which was one of the largest board certification, recertification, and CME training companies. And we took it all online. And 27 years later, they're still doing it quite effectively with many other organizations through a learning management system. So for us, and Bob, who's a partner in a general partner and a managing partner with me in the fund from the beginning, and also runs our educational network, on the network side, and is also a founding partner of the network. We have integrated education into it. Education at the patient level, education at the provider level, education at the innovator and entrepreneur level, and at the finance level for investment. So it's, and again, health professionals tend to be very focused on education. So that's important. And then as we're educating all these health professionals and all of these health professional entrepreneurs, we're bringing in our network of very targeted clinicians, many of which, I'll be honest, are first involved as investors because they see an opportunity. I always joke, when was the last time, and I'll throw a name out there, it's not the only one, but we live in Silicon Valley. When was the last time Kleiner Perkins knocked on my front door and said, you know what, we got the next Amazon in healthcare. You want to throw some money into our venture fund? Never. That opportunity wasn't there. So we wanted to democratize the investment process. And we are doing that now. It's not just a venture fund. We're doing special purpose vehicle investments in companies. We're looking at creating crowdfunding opportunities for non-accredited investors, for those health professionals that are not physicians, that are EKG techs and that are physical therapists who don't make the amount of money to become an accredited investor and being able to invest. They have an opportunity to participate. But the minute we get them involved as an investor, that's when we plug them into the network and we start getting them involved. So if they have a particular interest in blockchain or AI or VR or whatever it is in healthcare, they can educate themselves. But also each one of us is a knowledge leader or a subject matter expert in something in healthcare. And if we can create a network of 1 million health professionals that have targeted subject matter experience, then we can leverage that with our companies, and that's exactly what we do. So when we come in and do our due diligence, we make it very clear very early on that is our thesis and that's our model. That if you're looking for just money, we're not the right one. But if you're looking for strategic investment, then we are. And proof of concept, and then I'll stop, is that we were open, Bob, what was it, 3 months? And we got a call from Samsung. Okay, and they wanted to involve us in a deal that they were looking at. There's a company that we've invested in. You'll hear from them at some point in this conference, Sensifree, that's developed a way to monitor blood pressure non-invasively, as accurately as a very invasive way of doing it in the operating room. And when we identified that company, they wanted our clinical expertise to do the due diligence of that investment. And then we, a small little fund, got involved with Samsung. That really was proof of concept to me that we are moving in the right direction.
That's a good field of dreams kind of example. If you build it, they will come.
Exactly.
I'd be curious. I think it's admirable that you really acknowledge the whole spectrum of healthcare workers. It's not just doctors anymore. There's really a lot of people getting involved and democratizing the ability to invest or make a difference is a big deal. I'd be curious, you say social impact is in the name of the fund. What does that really mean? And how do acknowledging all the different healthcare professionals that are involved allow you to kind of maximize social impact?
Yeah, it's interesting. I've spent a lot of time thinking about that concept when we first started. And the nice thing about healthcare is virtually anything that you do in healthcare is probably falling under some part of the umbrella of social impact. But if you look at the true definition of social impact, a funny little story that I have is that one of my children is a finance major and a master's in business. And when I first approached him and he was very interested in social impact, I'll admit in a very ignorant way, I said, so what is social impact investing? What does that mean? Does that mean you make an investment, but you don't get any upside on the investment? You're just doing good? And he just looked at me and shook his head like children do with their parents. And he was right. And it made me do more research and educate myself about it. And you can still make effective returns when I'm put on my venture capital hat. But doing good and doing the right thing and improving things in the world. And look where we are right now. I think we're all more focused on that than we ever have been for a lot of different reasons, especially right now, becomes really your mission and vision. And then if you can make money alongside of that, all the better, right? So for me to be able to use the financial part to attract the clinicians or the health professionals, but then once they're in, giving them the opportunity to make those impactful differences in the companies that we invest in by helping us choose the right companies that are market disruptive. We have an investment, radiant oximetry, which is creating a trans-abdominal through the belly way to monitor fetuses during pregnancy and labor, monitoring oxygen saturation. Right now, we use fetal heart rate monitoring, and I'm an obstetric anesthesiologist. This is why I know a little bit more than probably most about this. But when my wife, who's a perinatologist, and I saw this technology, this is radical, game-changing technology to be able to identify a fetus that's in distress, or more importantly, not in distress, and getting an unnecessary C-section. This will radically change the care of pregnant women globally. And when we saw that, we were all over it. And then when I brought it to my network, labor and delivery nurses, to obstetricians, neonatologists, it was quite clear that everyone understood the value of this, and we went headfirst in from an investment perspective as well.
Nice. And that seems like you're really doing well by doing good and not the other way around.
Right.
That if you make investments that can have social impact, can improve quality of life, patient care, what have you, that the returns should be able to come, and that you don't necessarily have to sacrifice either or.
Yes.
Is that fair?
Absolutely. I would agree with that. I'd love to hear from you.
Sure.
I know you're going to talk here in a minute,
Please.
But I'd love to hear from your perspective with Amazon Web Services and Amazon from a mission and vision perspective focused on healthcare, how Amazon is viewing that, because clearly there is a lot of information out there that shows that Amazon is getting more and more involved on the healthcare side, is very interested in improving healthcare. So,
sure, be happy to. So, I'll start with AWS because that's the specific group that I'm in. I think we're big believers in kind of democratizing access, right? That previously, before cloud computing, it was, you had to have your on-prem servers, rack and stack them. And it was prohibitively difficult to do things at real scale. And when I say real scale, I mean, try to look at an EMR data, across a big health system in California or Texas or New York. And that the idea is that now if you have, petabytes, at your fingertips of storage, or, thousands of GPUs at your fingertips, for compute and real like AI ML work, that can really make a difference. And so, when AWS thinks about any one industry, we usually say, how can we best enable people to benefit from these advancements in technology? Because again, AWS's core competency, I wouldn't say is, healthcare delivery, right? We're not healthcare professionals or, fintech. And so that's why we partner with, the other behemoths of their specific domains to, again, enable, rapid change. And I would say, prototyping, breaking, experimenting, like that's all encouraged at AWS. I think for, more broadly, Amazon, there are different groups in Amazon that all have different priorities. And I think that's one of the things that's, was not apparent to me when I first joined AWS, but, .com is different from Alexa, which is different from AWS, which is different from Amazon Care, if you're familiar with that. And so each group kind of has its own thesis on how to best impact healthcare or other industries at large. And so it's interesting seeing the groups kind of interplay. And that is one of my jobs, is to make sure that, we can kind of communicate, what we're working on, and make sure that, we're at least mostly in lockstep when we can be.
Great. And I guess the way I'd like to wrap up a little bit is that creating the network was very important for us in terms of the way we create our collaborative strategic partnerships with organizations, because we want to be aligned with organizations that have a similar mission and thesis, but at the same time, the network that we're creating, we want to make available to those organizations, because you're right, healthcare, as we said, is a very difficult vertical to penetrate. And if we can create an environment that makes those resources available to our strategic partners, then we've accomplished what we're trying to accomplish from a mission and vision perspective. And a partner like AWS allows us to do it globally, like the name says. So I want to thank you so much for spending some time with us today. And I really look forward to our strategic partnership moving forward and working with AWS to grow our global network.
Thanks for having me.
Of course.